The thyroid gland is inferior to the larynx, what we commonly call the voice box. It's composed of a right and left lobes, connected by a thin strip called an isthmus. That is a word that should not exist. I mean, really, who put those letters together and thought that should be a word? Not me. Anyway, so you have two lobes connected by that little strip with the funky name, located anterior to the trachea. Microscopically, there are sacs, little spheres called thyroid follicles that make up most of the gland. The follicles have an outside lined with follicular cells and inside a jelly-like matrix called colloid. When the follicular cells are inactive, they're somewhat flat, so like a small, tiny little cuboidal epithelial cell or a squamous cell. But when thyroid stimulating hormone is stimulating the thyroid, they become active, and then they start getting much larger and fuller, so they're cuboidal or even columnar in shape. The follicular cells make two hormones, thyroxine, which is also called tetraiodothyronine, or T4, because it contains 4 atoms of iodine, and the second hormone is triiodothyronine, which contains 3 atoms of iodine. So collectively, T3 and T4 are called thyroid hormone. Okay, so there you see the big words, right? There are also some cells in the thyroid that are not a part of the follicles, and they're called parafollicular cells or extrafollicular cells or C cells. I know. But regardless which name you prefer to call these are the cells that are not involved in producing the T3 and T4. Instead, they are going to be responsible for producing calcitonin. Calcitonin is a hormone that's going to be released when blood calcium levels are high, and it causes us to take that calcium from the blood and to put it into bone. Now, we'll talk about calcitonin more when we talk about parathyroid hormone, because these two are antagonistic hormones, so it's easier to understand their role if we look at them together. So when we're making thyroid hormone, there's a stepwise process that involves several things that have to happen for thyroid hormone to become active. First of all, we have to trap iodine that is freely floating in the blood, and that iodine then is put into the colloid. So let's look first and figure out what we're looking at. Here we have a thyroid follicle. The follicular cells line the outside. The colloid is the jelly matrix in the middle. Okay, so here is a follicular cell. The yellow or the orange here would be the colloid. So the iodines are stored in the colloid. Now, as we're trapping that iodine and sending it into the colloid for storage, the follicular cells are making a protein called thyroglobulin. So they're synthesizing thyroglobulin, which is an inactive protein. It's then put into vesicles at the Golgi apparatus and sent into the colloid. Now we start breaking down that iodine by oxidation. Remember, oxidation simply means we're removing electrons. So the iodine is being oxidized. Now we've got these thyroglobulins in here. And so thyroglobulin is a protein, right? Remember, proteins are made up of amino acids. So we add iodines to one of those amino acids. That, if you want to know, that amino acid is called tyrosine. It really doesn't matter. I want you to understand we're adding those iodines to the amino acid chain, right? So we're adding them either 1 or 2 iodines at a time. So if we add 1 iodine, we make a T1. If we add 2 iodines, we make a T2. Now, those are not active hormones. We're making T1s and T2s and putting them right back into little vesicles and hooking them together to make T3s and T4s. So if you put 2 T2s together, you made a T4. If you put a T1 and a T2 together, you make a T3. All right, with me so far? So now we've paired the T1s and the T2s up, and we've made T3s and T4s, and they're stored here in vesicles right back in the follicular cell until they are secreted from the follicular cell into the bloodstream, which then transports it out to the body. All right, so now we figured out how to make it. Let's talk about what it does. Most body cells have receptors for thyroid hormones. T3 and T4 affect tissues throughout the body. So they act on their target cells mainly by inducing gene transcription and protein synthesis. And then these proteins can carry out whatever their job is in the cell. So some of the things that T3 and T4 is to do in the body is to increase basal metabolic rate, or the rate that we expend or use energy during our resting state. When basal metabolic rate increases, cellular metabolism of carbs and lipids and proteins increase, and of course that's going to cause us to create more ATP and use more ATP. It increases the concentration of enzymes that are involved in cell respiration, so we're breaking down these fats and carbs and proteins more and producing more ATP, increasing the number and the activity of the mitochondria, making more ATP. As cells make and use more ATP, of course, heat is being given off, basal metabolic rate increases, temperature increases. So the thyroid gland in this way produces hormones that help to maintain normal body temperature. And it's been seen that normal mammals, can survive for some time in freezing temperature. But if you take the same species of animal and remove their thyroid gland, those animals will freeze to death and die in that cold. Thyroid hormones have a permissive effect on catecholamines, epi and norepi. So the excess levels of the thyroid hormone include increasing heart rate and increasing the forcefulness of the heart rate and increasing blood pressure, because they cause epi and norepi to work even harder. The thyroid hormones are necessary for the development of the nervous system because they help to create synapses and help myelin to be produced and help the growth of dendrites. So thyroid hormones are also required for the growth of the skeletal system. They help to promote ossification centers in growing bones and making the proteins associated with bone growth. Help with the secretion of growth hormone and those insulin-like growth factors that increase the rate of mitosis. So deficiency of thyroid hormones during fetal development or during young childhood or infancy can cause severe mental retardation and also stunted bone growth, as we'll look at in a few minutes when we talk about the disorders associated with this. All right, so how is thyroid hormone regulated? Well, once again, we're going to go right back to the hypothalamus. So the hypothalamus, when T3 and T4 levels are low, negative feedback is going to cause the hypothalamus to release thyrotropin-releasing hormone, which travels through the blood vessels in the hypophyseal portal system there in the infundibulum, down to the anterior pituitary, which releases thyroid-stimulating hormone. Thyroid-stimulating hormone is released and travels through the bloodstream down to the thyroid gland, where it binds thyroid-stimulating hormone receptors. That's going to turn the thyroid on. It's going to release T3 and T4, which are going to increase basal metabolic rate, and then negative feedback shuts down the release of the TRH and the TSH. All right, so again, I've included the tables with the summary for you of what the action of the hormones are. So the T3 and T4, what controls their secretion, negative feedback, and of course the hypothalamus and anterior pituitary, and their principal action to increase basal metabolic rate, and a little more detail on how they do so. Remember, the parafollicular cells or extrafollicular cells or C cells in the thyroid gland are going to make and secrete the calcitonin. The calcitonin is going to be released when blood calcium levels are high, and what it does is to increase the action of osteoblasts so that they build bone matrix, and inhibit the action of osteoclast. Remember, clasts break down things. So it's going to cause those osteoblasts to take that calcium, hook it up with phosphates, and create bone matrix, so the calcium is stored in the bone. So some disorders associated with the thyroid gland. First, let's remember, of course, the thyroid gland affects pretty much the whole body. So many major body systems are going to be affected when there are hypothalamic disorder, or where there are thyroid disorders. Congenital hypothyroidism, remember hypo means low, so low secretion of thyroid hormones that has gone on through development and at birth can have very devastating effects. This was previously called cretinism, but we no longer use that term because a cretin is a little monster, so not the best term to use. Congenital hypothyroidism, much more correct and much more sensitive. But this condition can cause severe mental retardation and stunted bone growth, as we saw when we were looking at the actions of how thyroid hormone is necessary for the development of the nervous system and the body structures, the muscles and the bones. Certainly to have low levels of that would affect the development. So at birth the baby is typically normal because some of the maternal hormones, remember they're lipid soluble, can cross the placenta during pregnancy and allow for normal development. But because congenital means born with, these symptoms can develop shortly after birth. Most states do require testing of newborns, though, to ensure that there is adequate thyroid function. And if it is found that congenital hypothyroidism does exist, then oral thyroid medication can be given soon after birth, and of course would need to be continued throughout the baby's life. Hypothyroidism in the adult produces a condition called myxedema, which occurs about 5 times more often in females than males. One of the first things you see with this, of course, is an accumulation of interstitial fluid that we call edema, and it causes the facial tissues to swell and look puffy. A person with myxedema typically is going to have a slow heart rate and low body temperature, so they're very sensitive to cold, dry hair and dry skin, muscle weakness, and just overall tiredness and lethargic all the time. They also, because their metabolism is low, have a tendency to gain weight very easily. Because the brain has reached maturity already, mental retardation doesn't occur as we have with congenital hypothyroidism. But you may notice that the person does seem less alert. Again, oral thyroid medications can help to relieve these symptoms. The most common form of hyperthyroidism is Graves' disease, which again is more prevalent in females than males. Usually occurs before the age of 40. Graves' disease is an autoimmune disorder where you produce antibodies that mimic the action of thyroid stimulating hormones. So these antibodies are continuously stimulating the thyroid gland to grow and produce more hormones. So one of the first things you notice typically with Graves' disease is an enlarged thyroid, which appears as a goiter, and it may be 2 to 3 times larger than normal size. Another condition that typically develops with Graves' disease is called exophthalmos, which causes the eyes to protrude, and you may hear it called the bug-eyed syndrome. So treatment can include surgical removal of part or all of the thyroid gland, the use of radioactive iodine to selectively destroy some of the tissue, or anti-thyroid drugs that block the synthesis of thyroid hormones. And of course this is going to require very careful monitoring by your physician. A goiter that where you have that excessively enlarged thyroid gland appears as you see here. Of course this is more of a cartoon image, but you can see the thyroid gland has increased to very large size, and this can be associated with either hyper or hypothyroidism. In some places of the world where dietary iodine is inadequate, the low levels of thyroid hormone in the blood stimulate secretion of thyroid stimulating hormone. Thyroid stimulating hormone, of course, is going to cause the thyroid gland to constantly be stimulated, constantly be making lots and lots of thyroglobulin, but because there's not sufficient iodine, that thyroglobulin is just stored because negative feedback is not shutting it down, no T3 and T4 being released for the negative feedback, because you can't make T3 and T4 if you don't have enough iodine. The last disorder I wanted to mention briefly is Hashimoto's disease, and this is also an autoimmune disorder, and in this, rather than creating antibodies, you develop hypothyroidism because the immune system is destroying the tissue of the thyroid gland, and of course destroyed tissue can't create functional hormones. The parathyroid glands are located on the posterior part of each of the lobes of the thyroid gland. So you usually have one inferior and one superior. Here you can see 1, 2, and maybe one there and one there. Very difficult to see there. But it's basically, if you could reach in and pull your thyroid gland out and look at the posterior surface of it, you would see those 4 parathyroid glands. Some people have 2, some people have 3, but most people have 4. So the tissue of the parathyroid gland consists of 2 primary types of cells. The chief cells, which are the ones that produce the parathyroid hormone, are the primary or the most abundant of the extrafollicular cells. But there are also oxyphil cells whose function is not really known. But in the case of cancer of the parathyroid glands, it's seen that the oxyphil cells also secrete excess parathyroid hormone. So let's talk about the role of parathyroid hormone. And remember, I mentioned that we would talk about its role with calcitonin. Hang on just one moment here. I want to take a minute and look at this. Okay, sorry about that. I thought I saw a typo and I was going to have to do some quick work there to get that straightened out. Blood calcium levels are directly related to controls of secretion of calcitonin and parathyroid hormone using negative feedback loops. So rather than just one, we have 2. So let's look at what happens here. So when you have high levels of calcium in the blood, that's going to stimulate the thyroid gland to release calcitonin. Okay? So when the thyroid gland releases calcitonin, calcitonin is going to inhibit osteoclast from breaking down bone and stimulate osteoblasts to build bone. So when osteoblasts are building bone, they're hooking that calcium up with phosphates and creating something called calcium phosphate or hydroxyapatite. That's what makes your bone matrix. So when you're taking calcitonin, putting it together with the phosphate, putting it into the bone, then blood calcium levels drop, and the low levels of calcium then are going to have negative feedback in that we stop the release of calcitonin. But when your blood calcium levels drop, then your parathyroid glands are going to release parathyroid hormone. Parathyroid hormone is going to inhibit osteoblasts from building bone. Because remember, to build bone, those osteoblasts have to take blood calcium. But our blood calcium level was already too low, so the osteoblast will be inhibited, osteoclast will be stimulated. When you stimulate those osteoclasts, they're going to break that calcium away from that phosphate, release that calcium into the blood, so blood calcium levels rise. The other thing that's going to happen is the parathyroid hormone is also going to stimulate the kidneys to release calcitriol. Calcitriol is going to cause the intestines to become more permeable to calcium. And when your intestines are more permeable to calcium, then that calcium is absorbed back into the blood rather than being excreted in the feces. So an additional way to keep that blood calcium so that blood calcium levels go back up. So these two work in an antagonistic manner to regulate blood calcium. And again, like usual, here's your little summary table. I figure with the endocrine system you can't see this stuff enough, right? Sometimes students have a difficult time with this, so I do like putting these little summary tables in there so you get a pretty good view of it another time. But I wanted to also mention some parathyroid gland disorders associated with parathyroid hormone. So hypoparathyroidism, or too little parathyroid hormone, can lead to a deficiency of blood calcium. And that, of course, is going to cause neurons and nerve muscle fibers to depolarize and produce action potential spontaneously, and that can lead to twitches and spasms or maintained contraction of skeletal muscle. The leading cause of hypoparathyroidism is usually accidental damage to the thyroid gland, or they were accidentally removed during a thyroidectomy surgery when the thyroid gland was being removed. Hyperparathyroidism or elevated parathyroid hormone is most often due to a tumor on one of the parathyroid glands. So an elevated level of PTH causes excessive resorption of bone matrix, so we're breaking down too much bone. That raises blood calcium levels and phosphate ions and causes bones to become very soft and easily fractured. High blood calcium levels are going to promote the formation of kidney stones, so you have those kidney stones forming and can interfere with the filtration functioning of the kidneys. Fatigue, personality changes, and lethargy are also seen in patients that suffer from hyperparathyroidism.